Your body may know you're pregnant before your brain does, sometimes within 24 hours of conception. But here's what almost nobody tells you. Most early pregnancy symptoms you've heard about are scientifically impossible to feel that soon. So what's actually happening inside you, and when can you truly know? If you've ever found yourself analyzing every twinge, every cramp, every wave of tiredness, wondering, is this it? Am I pregnant? You are absolutely not alone. Millions of women go through this exact moment of uncertainty every single month. And the truth is, most of what we've been told about early pregnancy signs is based on guesswork, internet myths, and wishful thinking, rather than actual biology. Today, we're going to walk through exactly what happens inside your body from the moment of conception to the moment a test can actually confirm pregnancy. And I promise you, some of this is going to completely change how you think about your own body. Let's start at the very beginning. The conception countdown. When an egg is fertilized, it doesn't happen in your uterus like most people assume. It happens in the fallopian tube. That tiny fertilized egg, now called a zygote, doesn't just sit there. It begins a journey. Over the next 6 to 10 days, it travels down the fallopian tube, dividing and multiplying, slowly making its way toward the uterus. This is a critical detail because during this entire journey, which can take over a week, your body has absolutely no biological way of knowing pregnancy has begun. None. There's no hormone surge, no signal. Nothing your body can detect yet, because the real starting line of pregnancy isn't conception at all. It's implantation. Implantation is when that traveling ball of cells finally burrows into the lining of your uterus, usually somewhere between day 6 and day 10 after ovulation. And this is the moment everything changes, because implantation is what triggers the production of a hormone called HCG. Human chorionic gonadotropin. This is the hormone every pregnancy test on the market is designed to detect. Before implantation happens, there is no HCG in your system, zero, which means, biologically speaking, your body cannot signal pregnancy any earlier than this point, no matter how in tune with your body you think you are. And here's a fact that surprises almost everyone. This single piece of information debunks the majority of what circulates online about early pregnancy symptoms. If implantation hasn't happened yet, your hormone levels haven't shifted yet, which means feeling different on day 1 or day 2 after conception isn't your body telling you you're pregnant. It's something else entirely. So if your body can't even produce a pregnancy signal until day 6 through 10, why do so many women swear they just knew the very next day? That's exactly what we need to unpack next. Myth versus medicine. Can you really feel it that soon? Let's talk about some of the most common claims you've probably heard, maybe even said yourself. I felt implantation cramping the day after we tried. My breasts were sore within 48 hours, so I just knew. I had a weird metallic taste in my mouth almost immediately. These stories feel incredibly real to the women experiencing them. And that's exactly the problem, because feeling something real doesn't mean it's caused by pregnancy. Here's the medical reality. After ovulation, regardless of whether you conceive or not, your body produces progesterone. This happens every single cycle. Progesterone is responsible for breast tenderness, mood changes, fatigue, bloating, and even mild cramping. And it shows up whether or not a pregnancy is happening. This means the timeline for PMS symptoms and early pregnancy symptoms overlaps almost perfectly for the first 1 to 2 weeks because they're driven by the exact same hormone. Your body isn't lying to you. It's just that the signal you're interpreting as pregnancy is actually just your normal monthly hormonal cycle, doing what it always does. This is where confirmation bias plays a huge role, especially for women who are actively trying to conceive. When you want something to be true, your brain becomes hyper-aware of every physical sensation, searching for evidence. Studies comparing symptom reports between women who turned out to be pregnant and women who turned out not to be found something fascinating. The overlap in reported early symptoms between the two groups was massive. Sore breasts, fatigue, mild nausea, mood swings. Women experienced these things at nearly identical rates whether they were pregnant or not. So if you've ever felt frustrated because you were so sure and then your period showed up anyway, please know this. It wasn't in your head and it wasn't your fault. Your hormones were simply doing what they do every cycle. So does that mean nothing is real before a missed period? Not quite. There is one symptom that can genuinely be tied to early pregnancy specifically: implantation bleeding. This typically shows up 6 to 12 days after ovulation, around the same time implantation is occurring, and it tends to be lighter than a normal period, often pinkish or light brown rather than red, and shorter in duration. Some women also notice mild cramping during this window, caused by the physical process of the embryo attaching to the uterine lining. But here's the catch. Even this can be confused with a light period or random spotting, so it's not a reliable standalone indicator either. So if you genuinely cannot trust your body's symptoms to tell you anything certain this early, when can a test actually catch up to what's happening inside you? That's where the real science gets interesting. The science of pregnancy tests. Timing it right home. Pregnancy tests work by detecting HCG in your urine. But not all tests are created equal, and this is something most women never learn until they've already gone through the frustrating cycle of testing too early and seeing a negative result that later turns out to be wrong. Standard tests typically need HCG levels of around 20 to 25 milli-international units per milliliter to register a positive. Some of the more sensitive early result tests can detect levels as low as 10 milli-international units per milliliter. That sounds like a small difference, but in early pregnancy, it can mean the difference between a positive and negative result on the exact same day. Here's a statistic that genuinely shocks people. Testing too early doesn't typically give you a false positive. It gives you a false negative. In other words, if you get a positive result before your missed period, it is almost certainly accurate because tests are not designed to randomly produce positives. But a negative result taken too early tells you almost nothing, because your HCG simply might not have risen high enough yet to be detected. This brings us to one of the most important facts in this entire video. HCG doesn't appear instantly at a stable level. It doubles roughly every 48 to 72 hours in early pregnancy. Picture this. On day 8 after ovulation, your HCG level might be virtually undetectable. By day 10, it's risen, but still might be below the test's threshold. By day 14, which for many women lines up with the day their period would normally arrive, HCG has had enough time to climb high enough that home tests become dramatically more reliable. This is exactly why wait until your missed period remains the gold standard piece of advice from doctors worldwide. Not because earlier testing is impossible, but because it dramatically reduces your chances of an inaccurate, anxiety-inducing negative. For comparison, blood tests, specifically quantitative beta-HCG blood tests done at a clinic, are far more sensitive and can sometimes detect pregnancy as early as 6 to 8 days after ovulation. These aren't typically used for casual at-home confirmation. They're more common for women undergoing fertility treatments like IVF, where precise early monitoring is medically necessary. Now, here's some genuinely practical advice that can save you a lot of emotional roller coastering. If you are going to test early, test with your first morning urine. Overnight, your urine becomes more concentrated, which means HCG, if present, is easier for the test to detect. Testing in the afternoon after you've been drinking water all day dilutes your urine and your hormone levels along with it, increasing your chances of a misleading negative. And when you're reading your results, pay attention within the test's specified time window. A very faint line that shows up exactly within that window can still indicate a positive. but lines that appear after the recommended time frame, sometimes called evaporation lines, are not reliable indicators either way. But timing your test perfectly is only half the equation. There's something else that quietly throws off almost every calculation we've just talked about. And it's something most women don't even consider: your own cycle. Why your cycle length changes everything. Here's an assumption that trips up more women than almost anything else in this entire topic: the idea that ovulation always happens on day 14 of a cycle. This is taught almost like a universal rule, but it's actually based on an average 28-day cycle. And the truth is, a huge number of women don't have textbook 28-day cycles at all. Cycle length varies enormously from person to person, and even from month to month for the same person, influenced by stress, illness, travel, weight changes, and underlying conditions like PCOS. If you ovulate later than day 14, which is extremely common, every single calculation about days past ovulation shifts along with it. This means a woman who tests on what she believes is day 14 past ovulation might actually only be at day 9 or 10 biologically, simply because her ovulation happened later than the assumed average. This is one of the most common and most frustrating reasons women get confusing or inconsistent test results, and it has nothing to do with their bodies malfunctioning. It's simply a miscalculation of timing. So how can you get a clearer picture of your own unique cycle? There are a few genuinely useful tracking methods. Basal body temperature tracking involves taking your temperature first thing every morning before getting out of bed. A sustained rise in temperature after ovulation can help confirm it actually happened, and roughly when. Ovulation predictor kits detect the surge in luteinizing hormone that happens right before ovulation, giving you a more precise fertile window than calendar guessing alone. And tracking cervical mucus changes, which shift in texture and appearance around ovulation, can offer additional clues. Many women also use fertility tracking apps, which can be helpful for spotting patterns over several months, though it's worth remembering these apps are only as accurate as the data and assumptions you put into them. They're a helpful tool, not a guarantee. Think about two women, both testing on what they call day 12 past ovulation. One of them ovulated right on schedule, and her HCG has had nearly 2 weeks to build up. The other ovulated 4 days later than she assumed, meaning her actual HCG level is closer to what you'd expect at day 8. Same calendar date, same test, completely different biological reality, and completely different results. This is exactly why understanding your own cycle, rather than relying on generic day counting, is one of the most underrated pieces of advice in this entire conversation. Once you've accounted for your cycle and timed your test appropriately, and that test finally comes back positive, what should actually happen next? Confirmed. Positive. What's next? The moment a test shows positive, it's natural for emotions to take over. Excitement, fear, disbelief, sometimes all three at once. But from a health standpoint, there are a few important next steps. The first is confirming the result with your healthcare provider, who may use a blood test for further confirmation or schedule what's called a dating ultrasound, which typically happens between 6 and 8 weeks of pregnancy to confirm viability and establish an accurate due date. This is also the moment to focus on a few essential early pregnancy health habits, if you haven't already. Folic acid is one of the most important. It plays a critical role in preventing neural tube defects in early fetal development. Ideally, it started before conception, but if you're only finding out now, starting immediately is still strongly recommended by health authorities. It's also the time to avoid alcohol, certain medications that aren't pregnancy safe, and high mercury fish, all of which can affect early fetal development during this sensitive window. And depending on where you live, the path forward looks a little different. In the UK, the next step is typically contacting your GP, who will refer you into NHS maternity care. In the United States, this usually means scheduling your first appointment with an OB/GYN, often coordinated with your insurance provider. In Canada, care typically moves through provincial healthcare pathways, often starting with a family doctor or midwife. In Australia, many women begin with GP-led shared care models, and across much of Europe, midwife-led care is a common and well-established first point of contact. Regardless of which healthcare system you're in, the underlying advice is universal. Don't wait too long to make that first appointment, because early prenatal care is strongly linked to better outcomes for both parent and baby. Before we wrap up, there's one more thing worth addressing, because it might be the single most common point of confusion in this entire topic. The questions. Everyone asks, can a pregnancy test be positive and then turn negative? This does happen, and it's referred to as a chemical pregnancy. A very early pregnancy loss that occurs shortly after implantation, often before a missed period would have even arrived. It's far more common than most people realize, and importantly, it is not caused by anything the woman did. It's simply a part of the complex, sometimes unpredictable biology of early pregnancy. Can stress delay a positive test? Not directly. But stress absolutely can delay ovulation itself, which then shifts the entire timeline we just spent this whole video explaining. So indirectly, yes, stress can absolutely throw off when you're able to get an accurate result simply by changing when ovulation happens in the first place. And finally, do twins show up as positive earlier than a single pregnancy? There's some truth here. Because twin pregnancies often involve higher HCG levels, some women carrying twins do see darker or earlier positive results, though this isn't a reliable diagnostic method, just an interesting biological pattern. If you ever find yourself with a missed period, symptoms that feel persistent, and a negative test result, the right move is always to consult a doctor rather than guessing or repeatedly testing. There are situations where timing, hormone levels, or other underlying factors require a clinical evaluation rather than another box from the pharmacy. So let's bring this all together. The truth is, your body's real pregnancy timeline doesn't start at conception. It starts at implantation, roughly 6 to 10 days later, when HCG first enters your system. Everything you feel before that point is almost certainly your normal monthly hormones, not a pregnancy signal. And while it's tempting to test the moment you suspect something, the single most reliable evidence-based moment to test remains the day of your missed period, when HCG has had enough time to rise to a detectable level. Understanding this biology isn't just interesting trivia. It's genuinely empowering. It means you can stop blaming your body for tricking you. Stop spiraling through weeks of anxious symptom spotting, and instead approach this deeply emotional experience with real evidence-based clarity. Your body isn't working against you. It's simply following a precise, predictable biological timeline. And now you understand exactly what that timeline is. If this helped clear up some of the confusion or anxiety you've felt around this topic, let me know in the comments. I'd genuinely love to hear your experience. And if you found this useful, consider subscribing because we'll be covering more evidence-based women's health topics just like this one.